Welcome you all to Believers IAS Academy. In this today's topic of the day discussion, we will be discussing about open defecation. So why is it in news? It is in news because of the very recent UN report which clearly delineated or depicted the status of open defecation across the globe. And it clearly stated that the low income countries are the worst hit, or the condition of open defecation is 4 times higher than the global average in all of these low income countries. So in this today's particular video, let's try and understand what are the reasons, and we will also try and think of all the possible solutions, and in the end we will also try and solve one prelims question. So what is the status of the open defecation as with respect to the UN report? It clearly states that open defecation in low income countries is 4 times higher than the global average, and it also clearly stated that this is also another reason which is curtailing few of the countries, or it is curtailing the achievement of the 2030 agenda under the SDG, the Sustainable Development Goal 6. And what is the Sustainable Development Goal 6? It is clearly stating that by 2030 the agenda is to ensure that availability and sustainable management of water and sanitation for all is ensured. And also the report highlights that few nations, although we have few countries, especially the low income countries, which faces a very high problem of open defecation, still there are few which have tried to fully or nearly eliminate this particular issue. And it states that few countries, especially the Latin America, Eastern and Southeastern Asia, the Northern Africa, and even the Western Asia are the ones which it clearly states that they have nearly or fully tried to eliminate the open defecation problem. Now, with respect to India, if you're wondering, the report also clearly states that amongst the 16 nations which tried to reduce the open defecation problem, India is one amongst it. And also the report clearly gives that the reduction that we have seen in India is nearly 31%. And although it is important to keep in mind that we have seen this reduction, still many of, or the majority of the Indian population, or the majority of the Indian sections, right, especially the low income groups, even the marginalized communities, even the rural sectors, right, and also those people who are from a very degraded society, especially unprivileged sections of the community, they are the ones who are the worst hit, is what the report delineates. Now the report also highlights the conditions or the inequalities with respect to the WASH axis. So now, what is the WASH axis? It particularly focuses on the inequality in accesses to the safe water and sanitization and the hygiene conditions. So according to the report, it also states the inequalities which are faced amongst various sections with respect to the access to safe drinking water, sanitation and hygiene. So it gave various parameters, or it checked under various parameters, and these are the few important things to keep in mind. So one is a stark contrast between the rural versus the urban, where it clearly delineates that rural communities lag behind the urban areas, but also it has clearly stated that rural areas, it is trying to improve more better than the urban areas. And in terms of economic divide, the report also shows that a sharp gap exists between the richest and the poorest households, which is absolutely common, because the rich, due to the availability of more income, or let's say the more disposable income amongst the people from the rich category, they have accesses to more pure clean drinking water, and even for that matter the accessibility to ensure that they can safeguard their own proper sanitation, and also to ensure that live in a proper hygienic society. And the poorest households, it is self-explanatory, we don't have to mention any more detail. Now, talking about the marginalized groups, the report clearly states that the ethnic minorities indigenous peoples, especially the tribal sections and most of the underprivileged categories, and also people with disabilities face limited access to the drinking water, sanitation and hygiene. And it also clearly states that there lies a gender inequality in terms of the access that we are talking about, where women and girls are spending more time collecting water, adding to the gendered burden as compared to the male or the boy category. And the report even talks about the infrastructure impact, which says that communities without roads or connectivity see much lower levels, which is self-explanatory in nature. Communities where the development aren't sufficient or adequate obviously have problems with respect to the accessibility to basic essentials, basic needs, which is clearly visible or which is clearly seen. Moving forward, the report also talks about the progress made between the time period of 2015 to 2024, and in terms of sanitation and drinking water, it gives certain data which are important for the examination, which you have to know. So with respect to sanitation, it clearly states that 1.2 billion people gained access to safely managed sanitation, and it also says that the global average rose from 48% to a whooping 58%, with 3 in 5 people right now using hygienic toilets, which is very exemplary in itself. Now, talking about the drinking water, the coverage has been increased from 68% to a whooping 74% globally, and also the rural access improved by 10 percentage points from 50% to 60%, but urban coverage stagnated at 83%. As we previously discussed, the rural progress is seen as compared to the urban progress, which has stagnated to 83%. Now, talking about the challenges and the necessary actions, especially related to the low income countries, because these are the ones these countries are the ones which are trying, or which are not letting the entire world to go track or to achieve its SDG 6 targets or the agenda by 2030. So now, talking about all the necessary needs or the way forward, or the challenges or the needed actions with respect to the low income countries, the very first thing that comes to mind or is given is to spend or to increase the access to basic water by 7 times. So of course we have, especially in India, we have the Jal Jeevan mission. So we have to see how the mission has been successful in terms of getting every household with a piped water line connection. So with respect to India, it is through the Jal Jeevan mission. We have to see how from the examination point of view, it is important that you have to know the status and the progress with respect to the Jal Jeevan mission. And then it also talks about increasing 18 times, 18 times increase in basic sanitization and hygiene to meet the SDG targets. So of course, under the Swachh Bharat mission, way back in 2019, the Swachh Bharat mission had claimed that more than 85% of India, especially the rural, had proper sanitization, at least toilets in their houses. But still, it doesn't actually fully cover the aspect or the point that the country is open defecation free. Why? Because of certain bottlenecks or certain challenges with respect to people, where they have to first change their behaviors, and also second most important thing is, even if they have changed their behavior, they still have the toilets, but still the problem is with the access to water. So this was also another important challenge. And most importantly, all the toilets, majority of the toilets that were constructed under the Swachh Bharat mission, the biggest demerit was with respect to the disposal of the toilets, the fecal which was collected. So that was also another huge problem, because the toilets which were built were mostly built in a manner to contain the defecation or contain the excreta, and it was properly not planned in a manner where the clear disposal of this excreta, as to how this should happen, and the active involvement of the public or the local government, the local municipalities weren't weren't taking place. So hence the problem with respect to India in terms of open defecation is still existing, especially with respect to the small or the marginalized populations. So another important aspect or the important need is to make sure that the data collection happens properly, right? So we have to come up with an alternative data collections which is needed for small and marginalized populations to ensure no one is left behind, so that we get proper adequate data. Moving forward, what are the key insights or the takeaways from this report is that we have to understand water, sanitation and hygiene is as important as any other right, and it is a basic human right and not a privilege. That is one thing to keep in mind. And we have to also ensure that accelerated actions is very important to meet the SDG 6 by 2030. So this is alarm call for the government, and also for the local authorities, and even at the individual level, even the people, right, has to ensure that that is very critical to meet the SDG 6 target by 2030, particularly for the marginalized and the rural communities. So that is all for the video. So now we will discuss one prelims question. With reference to the Sustainable Development Goal 6, consider the following statements. It aims to ensure availability and sustainable management of water and sanitization for all by 2030. Second statement, low-income countries are the one or the only group not to track to eliminate open defecation by 2030. Open defecation has been fully eliminated in all regions, including low-income countries. So you'll have to select the correct statements. So that is all for this today's particular video. So for more such interesting and informative content, please do subscribe Believers IAS YouTube channel. Signing off, this is Madan Gopal. Have a beautiful day.